Welcome to the National Collaborative for Infants and Toddlers webinar on the fourth trimester, supporting optimal health and development for mothers and babies. My name is Andrea Palmer, and I am a program manager at the Pritzker Children's Initiative, which funds the National Collaborative for Infants and Toddlers. We've saved time to answer questions at the end of the webinar, but we encourage you to share any questions in the chat box as the webinar progresses. The fourth trimester refers to the transition period after childbirth when infants are adjusting to life outside of the womb and mothers are adjusting to new parenthood. This critical period is marked by significant biological, psychological, and social changes. The fourth trimester perspective draws attention to and calls for resources to address the overlapping maternal, physical, and behavioral health domains. Multiple issues intersect during this critical time, including maternal mood and emotional well-being, infant care and feeding, sexuality and reproductive health, including contraception and birth spacing, sleep, fatigue. Oh my goodness, give me 1 second, I'm sorry, I advanced my slide on this one. Sleep fatigue and actual physical recovery from childbirth, not to mention other critical issues such as substance use disorders and environmental exposures. By comprehensively addressing these interconnecting needs, service providers can improve health and well-being across 2 generations. In today's webinar, Dr. Sarah Verbiest and Nkechi Charles from the Jordan Institute for Families at the University of North Carolina will discuss the relevance of the fourth trimester and its impact on the health, growth, and development of the mother, the baby, and the mother-child relationship. We will also touch on specific policy changes that states could make to achieve greater outcomes for mothers and their babies. Dr. Sarah Verbiest is the director of the Jordan Institute for Families at the University of North Carolina School of Social Work and executive director of the University of North Carolina Center for Maternal and Infant Health. She is nationally known for her work on postpartum care and health equity. Her dissertation focused on the missed opportunities within postpartum care, and she later co-led a national think tank meeting on postpartum services and co-edited a special journal issue focusing on the postpartum period. She was a principal investigator for the Patient-Centered Outcome Research Institute's fourth trimester patient engagement award. She draws on more than 20 years of experience in maternal and infant health to support this work. Dr. Verbiest has given keynote addresses at highly visible conferences and has given voice to postpartum health issues via multiple media outlets, including NPR's Studio 1A and the Wall Street Journal. A mom of 2, Sarah brings her significant reach and influence in the field of maternal and child health to support widespread dissemination of fourth trimester work to professionals and women who are becoming mothers. Nkechi Charles is a doctoral candidate in the Department of Maternal and Child Health in the Gilling School of Global Public Health at the University of North Carolina at Chapel Hill. She is a mother of 2 daughters, ages 4 and 11 months. Her oldest daughter was preterm and spent weeks in a neonatal intensive care unit. Nkechi is connected to many different networks of mothers and worked with fourth trimester team to create newmomhealth.com. She has also spent many hours talking with new mothers who had a NICU experience. Her current research pursuits are at the intersection of maternal and child health, behavioral health, and addressing health disparities. Nkechi is interested in the many different factors that influence maternal health and well-being. Before turning it over to Sarah and Nkechi, let me tell you a little bit about the Pritzker Children's Initiative. The Pritzker Children's Initiative has a vision that every child will enter kindergarten ready to learn. To actualize that vision, we have a big, hairy, audacious goal, or what we lovingly refer to as a BHAG, that by 2023, 1 million more vulnerable infants and toddlers and their families will have access to high-quality services and supports in the prenatal to age 3 space. Our prenatal 3 outcomes framework provides the guideposts by which we are measuring our work toward achieving our BHAG. The fourth trimester work is at the intersection between healthy beginnings, and supported parents categories. Without further ado, please join me in welcoming Dr. Sarah Verbiest.
Thank you for that wonderful introduction. It's really an honor to be here and talk with all of you today. We really appreciate the opportunity. Nkechi and I have nothing to disclose except our complete and total passion for the topic that we are talking with you about today. So as we get started, I just wanted to take a minute and bring forward the faces and voices of some of the amazing women and mothers that are part of our collective work. Our team here at University of North Carolina at Chapel Hill is interdisciplinary, and we represent 4 different schools and lots of different perspectives, and we're all moms. And we have really committed ourselves to centering the voices of mothers across all of our work. So here you'll see some pictures of our team and some of moms that we've done focus groups with, and some moms that we spent almost 2 years building community and listening to what they had to say. And if you're interested in being part of our community, I think that this information will be available later, but we are very active on social media with Facebook, Twitter, and Instagram, so you can also join our community if you would like. So why is this so important? There are many reasons, but I think this slide in many ways summarizes why we really have hit a crisis point in our country around maternal health and well-being. I think many of you have heard that really terrible information that shows that women in our country are losing their lives at higher rates than women in other countries. In fact, our maternal mortality has doubled in the past 25 years. And within those statistics is the injustice that women of color are 4 to 5 times more likely to die giving life than women who are white. So this crisis has not only underscored a lack of attention to women overall and gender issues in our country, but has really put issues around racism front and center for us. And it's now time that we have to tackle them. So I think that's really important. It's really a clarion call to action. We also see that 1.6 million new mothers a year don't receive a postpartum visit. And when you consider the considerable changes that a person's body undergoes when they give birth, the risk, the experience, the pain, the newness, the fact that once 1.6 million women leave the hospital, they don't have any follow-up care is really concerning. We also know that 1 in 4 moms in our country is returning to work just 10 days after childbirth. So I don't know about you all, but I was struggling to just get myself showered and clean and close to being out the door 10 days after I had a baby. I can't imagine what it is like for moms that are forced to return to work so that they don't lose their jobs or so that they're sure that their family has the resources that they need. And finally, we have a lot of moms, and we've heard a lot more about postpartum depression, but still the majority of mothers who experience symptoms of depression are not accessing the help that they need. So this is not a small group of people that we're talking about. In our country, over 4 million women become new mothers each year. And something that we've heard in our research and in conversations and online is that there's this sense that women are like candy wrappers, we say. So when we're holding the chocolate, the baby, there's a lot of attention paid to us, lots of visits. There tends to be more resources available. But once the baby's born, we're like the candy's out and the wrapper is tossed aside. And we hear this theme over and over and over again in many different ways. And I think more recently this was actually deepened for us when some moms of color mentioned that they felt that their babies were also tossed aside in our country. So when I think about this, I think a little bit about my own story. So when I had my first child, I was actually a newly minted person with a Master's of Social Work and a Master's of Public Health in maternal and child health, and I was actually working in the maternal and child health department. And so I was really caught off guard by my postpartum body. I thought, you have the baby, take a shower, put your jeans back on, and you're fine. I had no idea what was coming, and I remember feeling really angry and feeling like this was some big secret that other women didn't think that they should tell me. Did not have paid leave, did not think about the economic impact on my family. And I think ever since that time, I have been really focused on this work and realizing that it's so important that we have these conversations and that people know what to expect. So you'll be hearing Nkechi and I talk a lot today about this idea of dyadic care. And so really, in our country, when we think about human babies come out quite vulnerable. A lot of human baby development, brain development, is happening outside of the womb and is really centered on that interaction and relationship, particularly with mom. Likewise, we know that when we have the birth of a child, we also have the birth of a mother. And so these two beings are so closely connected, and what one does and how one is so closely affects the other. And so that's why I appreciate what Andrea said about this is kind of that in-between space where baby may not be physically inside mom's body, but this fourth trimester, they are so intricately connected. So this slide is a summary of our research. We could spend a lot of time unpacking this slide, but essentially this shows that it's quite a complex time when we think about those first few months after a baby is born. And so when we look at this, if you look at the inner circles, you'll see lots of different issues that have been studied, that women have mentioned, from everywhere from mood and emotions and anxiety to thinking about medications. Can I go back to taking certain medications if I'm breastfeeding? What have I been exposed to? Thinking about physical recovery. Lots of conversation these days about contraception, exhaustion, pain. So these are all issues that tend to be treated separately. So infant care and feeding is often addressed by a nutritionist or a lactation person. We know that the contraception, if someone attends a postpartum visit, is often going to get contraception and maybe some advice about physical recovery. Mood is often treated by a mental health care provider, and really nobody talks about sleep. And what we've heard time and time again, that these are all inextricably interwoven. And I think that when we step back and think about it, it's very logical. If you're in pain, then you're not going to sleep very well. If you don't sleep very well, that can impact your mood, and your mood then in turn may affect your milk supply. And so women really talked about how the wholeness of women needs to be reflected in the way that we approach her care. And then likewise, we take a step out and realize, in addition to managing her own recovery and understanding how to care for this new tiny human being, that there's other work that's happening around self-identity, self-care, family care, and relationship care. There have been some studies that actually did MRIs on the brains of brand new first-time parents, both moms and dads. And what they found was that this is a period of rapid brain development and the new connections and synapses that are forming, which really underscores how much work new families are doing to adjust to this new role and to become a new family unit. So I just have a few slides to also continue to illustrate our candy wrapper point. So the Listening to Mothers survey is a great survey if you ever wanted to access it. And this is an example that lifts up care gaps that we see. So the question is, do you have a telephone number of a care provider to contact about concerns in the first 2 months after birth? And a quarter of the women who responded said that they did not even have the number of someone that they could call for help. When we think about pediatric care, you can generally pick up the phone and get an answer to a question almost at any time, and yet we're really finding that a lot of moms don't have access to the information and support that they need. We also don't think about the continuity of pain that some women endure. And so this is an example of looking and assessing pain, and it's differentiated by cesarean birth or vaginal birth. And if you look at this, you'll see that 18% of women that had a C-section are still experiencing pain a year postpartum, and 10% of women that had a vaginal birth. If you recall what I said about the impact of pain on quality of life and sleep, this is something that is really important to consider. We also know that women have challenges with headaches and backaches, tears that may not have been adequately addressed after the amazing effort they did to actually birth a child. And so I think this is an argument for some of the suggestions that we'll make later about the kinds of systems of support that are necessary. But I think people that interact with new moms need to, be aware of this kind of whole milieu of things that she's dealing with and likely not going to tell you about. Another really important area is around the need for maternal support, material support. So there is a definite need in our country around diaper insufficiency. And so this shows that, again, we're looking at over a quarter of new mothers report that they do not have adequate access to diapers. And this identifies where they try to get diapers and how they try to address that need. And we could do an entire webinar of the impact of diaper insufficiency on moods. It's been documented to increase postpartum depression, on child health, on parents' ability to get out of the door, to interact with other parents, to go back to work, school, and to make sure that their children can attend child care. And I think this is an example, again, of these interlocking needs that we have, where if we just say, oh, she's depressed, but we don't take the time to really think about the other stressors in her life, that we're really missing the mark. And finally, there are some unique populations of mothers who really need to be centered and cared for. And this is a list of some moms that we in particular wanted to lift up. Mothers who've experienced an infant loss may not be served immediately by some of your programs, but those mothers may have older children, and we just find that infant loss tends to be such a quiet loss in our country that we wanted to lift up and recognize. Mothers who are incarcerated, another very forgotten population with lots of concerns. Mothers who need substance use services. We could talk for a long time about policies that are taking place in this country that seek to punish moms, blame, shame moms, instead of really provide dyadic care to moms and babies. And then finally, a recent study that we did looked at mothers whose infants were receiving care in a NICU, and we identified that these moms are particularly at risk for having severe maternal morbidity and also a significant risk for depression. So just wanting to lift up some of these unique populations of moms, and there are probably other unique populations that you can name as well. This is something else that we really wanted to lift up that came from our research, and also you can take a minute on any of our social media platforms and you will see this as a theme that emerges. So moms are worried. They want to be the best moms possible. They're afraid that they're not doing a good enough job. They're very anxious about doing things the right way and caring for their baby. Moms, we're really good at guilt, and if anyone on this call is a mom, I think you know what I'm talking about. We're pretty good at self-blame, and we're really good at comparison. But when you take all of that with the brand new mom, with all of the other things that we've talked about, it can be really challenging. And we see that moms from all different perspectives and populations have a deep fear that if they're seen as not doing a good job, that someone's going to take their baby away. And so what we would offer as a counter to all of you when you're engaging with new moms and new families is to just hold them in deep love and compassion and spend energy reinforcing all of their strengths and all of the things that they're doing well, because that's ultimately what moms really need to hear. And if there's nothing that you take away from this webinar except that point, I hope that you do. And so there are consequences for providing inadequate care. And many of these link to some of the things that we know need to be in place for children to be kindergarten ready. We know breastfeeding is really important, and when we don't provide good care, we're not able to achieve breastfeeding goals and sustainable goals. We've talked about depression. Moms who are depressed are going to be less likely to have the energy to be communicating with their babies, reading with their babies, and functioning. That impacts moms and impacts babies. We know that without really great, consistent, adequate postpartum care, women who've stopped using tobacco during their pregnancy are very likely to start using tobacco again. I mean, it is a good coping mechanism for stress. And so I think this, again, underscores the need for more support. We know many women have an unmet need for chronic disease management and risk reduction. Women who've had preeclampsia or other conditions during pregnancy are actually have signaled a much greater risk for future chronic disease as well. We talked about suffering due to unaddressed pain, and also that if women aren't getting adequate supports and counseling around contraception, there is a risk for short intervals between pregnancies that can have some impacts on women's health, on infant health, and also on family finances and the development of older children and other babies. So it's really important that we do this care, and it really does matter. Some other just key challenges that I wanted to lift up overall about this period of time is that we found that there's lack of timely, relevant, credible postpartum information. This has emerged consistently that women didn't know where to go for information. What they found didn't make sense to them. We found that, as we mentioned before, care is too little and too late, and for some it's not even available. That women reported limited access to resources and services that they need or not knowing how to find them. And I think overall we saw that women have to figure out what they need and how to get it. So systems are not mom-centric. So we're making this poor, exhausted new mom have to work across multiple systems to try to care for herself and her family. We heard a lot of stories about biased, judgmental, and really misaligned clinical encounters that were really quite dismissive of the postpartum experience and of women's different perspectives and needs. And there's also a lot of cultural and social stigmas and particularly unrealistic expectations that I'm just going to bounce back, I'm supposed to be really happy, I'm going to show everyone that I've got my act together, I look great. And these are just things that we shoot for, may not achieve, and feel that we have not done what we should as moms. And so as I transition over to Nkechi, Amelia Gibson on our team, as we were having a deep conversation about this around the table, really said, you know, motherhood should not mean risking my health, happiness, or life. And we agree. And this is kind of our call to action about the importance of this time. So with that, I'm going to hand it over to my amazing colleague and friend, Nkechi Charles.
Well, thank you very much, Dr. Verbiest. So my name is Nkechi Charles, and I want to thank you for the opportunity to share from a mother's perspective. As a researcher, the work that I do is inspired by mothers and also my own experience entering motherhood, and as well as my daughters. So the picture you see here is actually my firstborn, her little cute feet, and my father's holding her. And I just thought it was a precious picture to take years ago. And so I'm just gonna give you a recap of basically my journey into motherhood. My husband and I were expecting our first child as I was completing my master's in global policy studies. And I happened to be doing my master's paper from a global perspective, exploring what it meant for women to navigate and negotiate for the resources that they needed for the well-being and that of their baby. And I was discovering what's not enough just to have services available, but it was important to ensure that there were systems in place to ensure that there was improved accessibility for those mothers. And so 2 months after submitting that paper, I found myself in the throes of navigating and negotiating the healthcare system in the US. So as I begin to share my story, I want you to keep in mind just imagine of a new mom navigating and negotiating a healthcare system. And I want you to just count the number of ways I'm interacting with the healthcare system after giving birth. And so just to rewind a little bit earlier, when I returned from my baby moon with my husband, my mother-in-law actually noticed I had gained a significant amount of weight and suggested that I make an appointment with my OB. Within 3 hours of arriving, my systolic blood pressure went above plus 200, and my diastolic number was over 100. And so I was diagnosed with severe preeclampsia. Now, mind you, I have no medical history, perfect health. The only difference was I was at age 35 and delivering my first baby. I was given 48 hours to receive cortisol shots to prepare my daughter's lungs and was given magnesium sulfate. And at 30 weeks, my daughter was born weighing 2 pounds and 5 ounces, and she would remain in the hospital for 70 days. Of those 70 days, I remained a patient for 10 of those days postpartum. And unfortunately, I suffered from confusion and memory loss as a result with the magnesium sulfate. So I don't even remember meeting my child for the first time, but there are photos of me smiling. I just don't remember. So I have to rely on those photos to have that memory. So it took about 10 days to try to regulate my blood pressure. My OB, who was amazing, tried her best, but I had to be transferred to the internal medicine doctor to get that regulated. And while I'm in the hospital, I'm being woken up every 3 hours to do that blood pressure check. Meanwhile, I'm also pumping for that liquid gold, for that breast milk for my baby to ensure that she has the best chance of surviving every 3 hours. Now, those 3 hours were not in sync. And so I would be pumping and go to sleep, be woken up in an hour to get my blood pressure checked, and then fall asleep, then be time to pump. And so that went on to the point that I actually had to talk to the nurse and the technicians and I said, let's negotiate. Can we streamline something here so I can get some sleep? And somebody once told me that you don't go to hospital to get well, you go to hospital to get recovered, and then you go home to get well. And so in all those throes, I'm still having to engage in the NICU environment, engage with a neonatologist that tells my husband and I that my daughter may be at risk of a serious condition that may lead to mental and physical disability long-term. And there was a treatment, but there was only one paper about the treatment, and there are pros and cons. If I didn't do it, there was a risk of this, some of these consequences without the treatment. And if I did the treatment, there may be some symptoms or side effects that may happen later on in life. So emotionally, that was intense for me. Also, I'm regularly meeting with a lactation consultant, learning how to breastfeed my daughter because she's relying on a feeding tube. And during that time, I also discovered a lump in my breast. Now, let me fast forward and let you know that the mass was benign. However, it took me having to navigate through the cancer center department 2 inconclusive biopsies, after which I can only have surgery to confirm that it was indeed benign. And so mentally having to go through that simultaneously with the NICU environment, as well as everything that's going on, needless to say, it was quite a bit. When we eventually left the hospital after 70 days, my life became full of engaging with developmental specialists, ear, nose, throat doctor, optometrist for my daughter. And I'm happy to say that she is happy and thriving and developing right on schedule as she should. So let's fast forward about 4 years, and my eldest is 4 years. And I have a completely different experience with my second pregnancy. My baby, whose birthday will actually be tomorrow on the 21st, she'll be a year old tomorrow, was born at 41 weeks. She was 3 times the weight of my firstborn at 7 pounds. The difference that I approached this is after a year of being a doctoral student in maternal child health, I was determined to do my best to make sure that this would be a successful pregnancy. So I had a preconception appointment. With a history of preeclampsia, I knew I was considered high risk. So my husband and I secured a preconception appointment to discuss how we could prepare to expand our family. I also developed a birth plan, and I know some people have different ideas about birth plan, but I intentionally did it in collaboration with my maternal fetal medicine specialist, who is a nurse practitioner, and my doula. Now, there was a negotiation process as those 2 individuals represented 2 different perspectives, but it gave us options so my husband and I can sit down to understand what we wanted if we were given an ideal birth situation. We even toured our hospital, and we spoke with the labor and delivery nurses who are amazing at what they do. And I happened to ask them, so what do they think about a birth plan? And one lady was completely honest. She was like, we can't stand them. And I politely said, well, we're going to have one. So tell me what's important for you to know. And based on that, I created a simple 1-pager but I had made sure that I tapped all those individuals to understand what could be most effective in communicating my desire in this second pregnancy. And all this to say that I successfully had a VBAC, a vaginally birth after C-section, medication-free. My husband and I had a joy of bringing our baby home 2 days later. But it was actually the first time of us having a newborn at home. And we didn't know what to do because our firstborn was about 2.5 months before she actually set foot in our house. Now, I acknowledge that things did not go my way because I negotiated all the details. There's things that could easily happen that are unexpected and not anticipated in pregnancy and in delivery. But what it did do is it allowed my husband and I to feel comfortable in sending all the resources that were available to us and how we could access it and how we can engage those who are involved in our care. Now, I wish I could say I was symptom-free after this pregnancy. Postpartum, I did discover that I had dystasis recti, which is ab separation, where in fact 1 in 2 women have a mild form of dystasis recti and are not even aware of it. But it can have serious implications for health later on in life when your core is destabilized. And I also had a compromised pelvic floor. And so I realized I would have to do some navigation yet again. And so I sought out to get a physical therapist that focused on women's health. And I was met with a waiting list of 6 weeks. Now, 6 weeks postpartum is a critical period, not only for mommy and not only for the baby, and how they engage with each other. And if a mother has a compromised core, her picking up that baby, getting up and down every 2 to 3 hours, it takes a lot of demand on the body. And so I ended up having to go into another health system and was able to get an appointment at 2 weeks. And I'm so grateful that I was able to do so. And that particular physical therapist even allowed me to bring my baby in. So she would hold my baby as I'm doing my physical therapy exercises. Had I not had that opportunity, even with the resources that I had, it would have been very difficult to attend to my own self-care and making sure that I was building my body up so I can adequately take care of not only my baby, but also my 4-year-old. Now, I realized I have talked so much and I gave you a huge overview of my experiences with 2 pregnancies. And it wasn't my intent to overwhelm you all, but I wanted to sort of get your mind thinking about all the things that a new mom is having to navigate and negotiate for an extreme circumstance with having a NICU baby and even with having a healthy, perfect pregnancy. And all those things, the tensions between whether I focus on the baby or whether I focus on myself. Now, I know that not all stories are like mine. There are some that are a lot more complex. I'm part of a community of women who have survived bravely preeclampsia, and I hear some completely difficult stories, but they are strong as they walk it out. The point is, what I want to emphasize is I was in a position of privilege of being blessed to have a mother-in-law who was a retired nurse of 25 years who recognized signs that I did not recognize. Had she not told me to make that appointment, I would not be speaking to you today. I also had a supportive husband. A lot of times husbands get missed and excluded from the conversation, but he too had to go through the NICU experience. He too had to witness a wife that was basically undone by the experience. And how does he care for his first baby as well as a wife who's going through a process that he doesn't completely understand? And he needed support as well. And so I just want us to make sure that we are always thinking about that there are challenges that women go through, not only caring for their babies, but also caring for themselves while they're recovering. And as a person who has been privileged with all the support that I have, I can't just help but think about the women who don't have those same resources, that are not in the same position as I am. And I'm thinking of always wanting to make sure that if we want our children to have the best chance as they develop, we also must support mothers and making sure that they have the care that they need, so they're free to actually care for their children in the way that they want. So thank you so much for letting me share my story, and I'll give the presentation back to Dr. Verbiest.
Thanks, Nkechi. And I've been lucky enough to get to meet both of her amazing girls. And it's just It's a blessing to be able to be doing the research work together that we're doing. So I just wanted to put this slide back in to link back to the work that you're doing, and something that as we look at this, we think a lot about infant developmental milestones. In fact, I remember the book I had that was like every week what your baby was supposed to be doing. And we don't kind of pair that with what does the development of a new mom or a new dad or new partner look like? How are we changing and growing and adapting each stage of that newborn journey? And I don't have the answer for you, but I can say that there's a lot of moms that would certainly like to have that, because I do think that that plays into this idea of how is this dyad and family developing together. There are also great things, though, in your framework that I'm going to talk about and lift up when it comes to strategies. So I wanted to pick up on something that Nkechi said about the importance of engaging fathers. So there is strong evidence about early attachment for fathers, and that there's a significant role that they play in language development. We also heard across all the work that we've done with moms about how important their partners were in caring for them in those early days, in protecting them from visitors that they didn't want to talk to. Some of them talked about how their partners, were really good at keeping a schedule about when they should take Tylenol and when they should take Advil, and just really talked about what a critical role that was for them. We also know that there's research that shows that dads have a huge physical response when they see the birth of their child and when they interact with their child as a newborn, that they have very high levels of, I think it's estrogen, that flood their body and really kind of bring out a caring response for them. And so having them close by to be part of those early days and weeks is really important for their lifelong connection to this little person. We, as Nkechi mentioned, we know that partners are particularly overlooked by providers and home visitors and others. In some cases, there's not even a checkbox for dad. And so thinking about how local policies or how your programmatic policies engage or disenfranchise dads is really important, because if we want to provide great support to mom and there's a partner around to do that, then by empowering him, engaging him, and providing him with education and support, it's a really great way to strengthen a family. Another strategy that we heard about a lot across our groups is this idea of shared decision making. And this is often considered in a clinical encounter, but I think that this can take place anytime that someone is providing a service or a resource or support to a new mother, or trying to work with a new mother about how to potentially best talk to and care for her child. And so we know that shared decision-making really brings two experts to the table, understanding that women and their partners are really the experts in their own experience, what works for them, and what matters most to them. And we know that the provider is an expert in the clinical evidence, or also in other cases in infant development evidence that is also important. And so when we can honor the expertise and knowledge of both of these groups and kind of come together in a way that is conversational, that's respectful, and that really helps come to place where what is suggested is something that families are actually able and willing to do. And again, as I mentioned, really elevating the strength as mothers and really respecting their decision-making is critically important. So you may or not be aware that the American College of OBGYN, I think it was last year or the year after, just recently announced new postpartum guidelines. So as someone that did her dissertation on the postpartum visit, I was very excited to see these, because the past guidelines were were extremely loose and really didn't even describe what should be the content of postpartum care. And so I share this with you because I think it's important, as it's really opening up this idea that all women should have some kind of contact within the first 3 weeks after giving birth, and women who were high risk should receive follow-up in person within 1 to 3 weeks, and should have regular blood pressure checks, and that care should be ongoing as needed and should be well transitioned to well woman care. And so what this does is it kind of challenges that idea. What we say is, you just kind of deal with it for the first 6 weeks and then come in and we'll make sure you're okay. It really kind of opens this up as being a more woman-led way of accessing care. And as much as we love this, we can say that the reimbursement guidelines, certainly haven't caught up with this. We know that there are a lot of challenges with this way that the postpartum visit is paid for. It can often be billed for at the time that a woman is discharged from the hospital. And so in many cases, there's not a great incentive, economic incentive, for providers to get her to come back, and frankly, even less incentive to provide more visits for the same amount of money. So I think we needed to have the new practice standard set, and now the rest of us need to know that this is a new standard and really push to shift that paradigm around that postpartum visit. Some other strategies that we really wanted to lift up is that, again, it's so important to have access to comprehensive healthcare services that are including specialists like physical therapists, as Nkechi mentioned, and postpartum doulas, actually having a 24/7 nurse hotline that someone can call when they're freaking out. I can just share that I did not understand what would happen when my milk came in for the first time, and it was at first a very exciting experience, and then it became a rapidly terrifying experience with not knowing what to do. I was lucky to have a number to call and get some help, but we have heard from many moms about the 2 a.m. milk coming in, this exact same experience, and having absolutely no one to call except for Dr. Google. Having support for stress management, nutritionists, all of this is really important, and we believe that the minimum we can do is to make sure that all women in this country have access to quality healthcare services for at least the first year postpartum, and that's just really baseline. We need to pay more for maternal care services. I think that our colleague, Dr. Stubbe, said they get paid maybe, I don't know, just a few dollars when they're doing some of this really important screening. So we really need to pay for better care. We would love to see the extension of centering programs to really provide ongoing support for new moms and parents. So centering pregnancy is something some of you may have heard about. It's group prenatal care, but that usually ends with the celebration at around 6 weeks. And this is largely because the billing of these constant billings is done. We would love to see these programs continue, and in the case where they're centering parenting, we would really like to see that curriculum focused on mom as well as on baby. There's a lot of wonderful value in bringing new moms together to create community with and among each other. Some other things, to really thinking about value-based payment and thinking about what are the quality of care standards for postpartum care and services, and how do we hold people accountable for them, and how do we get insurers to pay for them. And then ultimately, we really need improved training on understanding the postpartum experience, postpartum needs, communication, and the implicit bias that's rampant in our system. I think in Nkechi's story, it's just so striking that in considering all that she was going through, she had to actually negotiate among the people that were supposed to be providing her care, who clearly were not censoring her or even thinking about her needs. So the ACOG also recommends setting a postpartum care plan and thinking about the care team. And so these are some of the things that they recommend. Guidance on what to expect after birth, that would have certainly been helpful for me. Lining up community support, so knowing who you could call if you're having symptoms of depression, getting that number, knowing who to call, knowing that they're in your insurance network, for example, the number of a diaper bank, just thinking about what are some of the other people and services that one might need to access and have that prepared in advance. And we also would like clinics to do the work of knowing who is in network and who is not in network, because when someone is depressed and you're calling around trying to find someone to see you and trying to figure out if they're covered by your insurance plan, if you have insurance, is just kind of crazy. But it's also important to be recognizing trauma and thinking about what is some of the unmet trauma and what trauma might have been triggered by childbirth, and then really asking moms what they prioritize and helping them kind of think through what kind of supports are they going to need in those early weeks. So I will say that on our team, we had a natural experiment with someone on our fourth tri team who was pregnant, and we kept trying to get her to do the postpartum care plan, and she would get to the point where it was, who's going to take care of your baby when you go back to work? And it stopped her every time. And we've talked to other moms and realized that there are points in this plan where there aren't resources or there aren't services, and that can be extremely stressful. And so we would really love to be doing some more research and learning more about how to create good care plans, but then also realizing that sometimes the process of the care plan can identify what could be pain points, such as, I would really love my mom to be with me, but my mom is not going to be able to come and be with me. This is a really great study that was done by Dr. Elizabeth Howell, and I'm going to talk about it in all of 30 seconds. But basically, she provided 15 minutes of anticipatory guidance to pregnant women in their last trimester of pregnancy. And these were just some of the topics that she covered, just to kind of let women know, hey, this could happen. There will be pain. You will pee a little bit when you sneeze or laugh. That you might lose hair. What is a hemorrhoid? And spent 15 minutes on that. And she found in her study that with just that brief encounter, that she reduced depression symptoms through 6 months postpartum considerably, as you can see on the slide. The women that received that anticipatory guidance were much less likely to have depressive symptoms at 3 weeks, 3 months, and 6 months. And she also found that preemptive counseling increased breastfeeding duration. So in our work, we heard from women that they were really challenged in accessing self-care and postpartum health-related information. So these were some quotes that we pulled out to share. So, when I had my babies, no one had answers for me. I felt very alone. There were not any formal places for information about what to expect during recovery from a maternal near-death event. That just is stunning, isn't it? That's just stunning to me. I searched for help but got no answers. And sadly, I was only given information because I knew what questions to initiate myself. And I think within here we see the range of Nkechi's story and my story, where we maybe new to ask certain questions and think about how many women out there that aren't even sure what they need to ask. Oops. And so, but we have a happy ending on this one. So building on that work, we worked with moms across the country to design newmomhealth.com. And so we just released this in September as a team, and we would love for you to all open that up, look at it, and share it widely, because we were able to put it together with a tiny bit of money, a lot of love, and several prayers. We've been able to launch it, but we don't have the money to actually widely market it. So we would love it if you would look at it. And if you look at that, you will see the language that we are using, where we are, and this language was fully interrogated and brought forward by moms. So for example, we don't say that something is normal. We might say that something is common. It's a small shift, but you'll see across the language small shifts like that, where we are constantly affirming, where we're suggesting when we know that there's not great research, because there's not great research in postpartum health and care that will offer different options or suggestions and provide full information. And if you look at that, you'll see that we first and foremost centered the information that she needs for herself and her body and her well-being. We talk about what is needed to build a village around her, and I think if you look in there, it can potentially spark ideas for some areas of action and strategies. We also talked about infant care, but in the context of caring for an infant within a family. So often we put everything that this child needs of the most perfect care forward and forget that there are humans that also have needs that are caring for this child. And so we try to offer some information about infant care, but thinking about the context of other children and family and healing and recovery. And then I think later on you'll see how we've been connecting with different social media to really elevate the different voices of women and their experience. And we're very excited that this year, by the time we get to October of 2020, that this will be translated culturally and linguistically into Spanish. So we're very excited. So just a few other suggestions. So we really see that moms need a village of support. So I've talked a fair bit about that, the clinic and the woman interchange, but we also know that clinicians really need a community of support to really be providing this longer-term support for mom, for the family as they go into this new journey. And so some of the things that we have heard and ideas that we would love to share with you about is about thinking about how do we build community support and social capital. So we heard that it's really important to find family-friendly places where new parents can connect, where they can get resources, you know, those old-fashioned bulletin boards, you know, where you can see what's available, what's happening, places that people with young children can gather and feel a little bit like themselves, as well as being in a place where it's okay to have young children. In some communities, Parks and Rec offer really nice activities for moms to get out and walk, dads to get out and walk, chance to come out and play and get to know each other. Some libraries we found do wonderful activities that can be both educational, but that can also be providing a chance and place for new families to convene. There's work that's been done at the Carolina Global Breastfeeding Institute here at UNC around how to create breastfeeding-friendly communities. How do we find ways that moms who are feeding their babies are welcomed in many different spaces and places? Thinking about how we can offer support groups and how we can create social media connections. A lot of connection is happening online. So if you're providing services and you're not keeping an eye on Facebook or knowing how the moms are communicating about you, as well as with each other, that would be something to pay attention to. You know, we're seeing a growing opportunity for people to kind of, you know, call in an order and drive by and have their groceries put in the car. I think thinking about how those different services can be utilized and potentially making sure that we can extend those to the moms that need it the most is something to consider. And I know I've seen a little bit in the chat. I can't really read the chat, but I've seen the word home visitor pop up here and there, and I know that it certainly came up in some of the questions in advance of the webinar. And absolutely, home visiting is a wonderful strategy of a way to really have a real personal touch with mom and the family. Also child care providers for those that are caring for children, these may be in informal and formal settings, have a lot of really important interchanges with new parents. And I think that challenging home visitors to not only have that one-on-one interaction, but to think about how are they strategically connecting new moms with each other. How can they really help getting needed services? How can they help problem solve around sleep, work, and balancing family needs? Because as any of you that are in the home visiting space know, this is critically important. And also, how can we provide tips to things like earned income tax credit and other ways that we know we can get resources back to families that need them? And I think just to kind of go back to the strategy of connecting new moms with each other, so I recall being at home with my second child on very newborn. I think he was maybe a week old, and just lonely. My mom was there, and I was like, I didn't have a community. And my mom looked out the window, and she's like, look, there's a really pregnant lady walking down the street. And I kid you not, I handed her my baby, and I actually went running out the door and introduced myself to that mom. And she knew another pregnant mom in the neighborhood, and the three of us actually created a really nice and supportive community with and for each other. And how nice to have home visitors also serving in that same role that my mom played. So I think that there's a lot that can be done here, and I would like to just go back to what I'd said, though, about the importance of those encounters, looking at shared decision-making, and really being opportunities to lift up and highlight all the things that she is doing well and see her as a person and have a chance to really ask her not just how are you doing and assuming that you're going to, then we get that I'm fine, but kind of really asking more probing and interesting questions to really find out how she's doing and what she needs. And policy also really matters. And I know this is something that the Pritzker Foundation is focusing on, and I think it's important. Some of these levers, while they're hard to push, would absolutely be game changers for American families. So I think first and foremost, thinking about workplace accommodations for pregnant women and new mothers is really important. Thinking about job production, we just had something that came up and passed in North Carolina in our child fatality task force. I think North Carolina is one of the last states to not have actual pregnant worker accommodations, and I just think it's crazy to think that someone would lose her job because she needed extra bathroom breaks. So I think thinking about how we're protecting the rights and well-being of pregnant and new moms at work is important. Thinking about policies and education that may create roadblocks for new parents. The graduate school, fellowships, and other spaces are not very friendly to students that have had a child maybe mid-semester and how they can actually complete and stay on track. Making sure that things like breast pumps are available before a baby is born. We found out in one of our research groups that this particular mom was unable to get her electronic breast pump from her local WIC until she had her baby, when actually a breast pump would be really handy for that 2 a.m. Engorgement challenge. Paid family leave and paid sick leave, again, big controversial policies in some places, and again, very good evidence that this would improve outcomes for mom, address depression, and actually be safer for children. Some other things that we identified that you may not think about is around transportation. And there are different rules about how you can transport infants and young children, whether it's in Medicaid vans, DSS vans, or on public transportation. And so if you're wondering why and how some people are getting to your services, maybe stop and think about what the transportation policies are. Housing and legal services are a challenge. Subsidized infant care is particularly important. We talked a little bit earlier about access to diapers and feminine products. And also, in certain cases, wouldn't it be great if we could have respite care for really high-need situations, particularly thinking about moms in recovery, moms who are single, moms who've been through trauma? So these are just a few things that it would be great if y'all worked on. It would be awesome. I know it's certainly something that our team is exploring and trying to lift up. And then just a few more slides. This is really helping us think about systems of support that really matter. So this is something, as was mentioned earlier, we did a national think tank work, and we did that in partnership with AMCHIP and the W.K. Kellogg Foundation. And we had a lot of complex information, and we ended up boiling it down to just this one infographic. And something that really was clear, and something that Nkechi mentioned, is about the fact that new moms have to operate across a variety of systems that aren't centering her. And so might it be possible for you to think about convening all of these different folks, WIC, childcare, pediatricians, employers, insurance companies, home visiting programs, diaper banks, social services, behavioral health services, transportation, and actually kind of thinking about how are those systems making it easier or harder for new families to get what they need, and really take some time and explore that. I think it could be very interesting what you would find. And I also think that you would find both some small P policy issues that could be addressed fairly quickly while we're taking on the big P policy issues such as paid family leave. So in conclusion, I think it's fantastic that you all are paying attention to postpartum, because we believe that this is an important time that's going to help you all achieve your goals for kindergarten readiness. And I think you know many of these perspectives, and I think potentially arguments or points on this slide, so I don't feel like we need to go in great depth. But wanted to lift them up as that we know that this secure parent-infant attachment, this building of family trust, and being responsive to cues and having positive communication are really foundational. We know that human babies, as I said before, have a lot of brain development that's happening that's driven largely by their social interaction with their caregivers. And we know that there's a strong link between mom's health and well-being and her capacity to connect and engage with her children. And so in conclusion, the fourth trimester is really a critical transition period for families. We believe that postpartum healthcare, education, and services really need to be tailored to the woman's experiences, preferences, and constraints, that communication should be compassionate and culturally sensitive, that care should be taken to really examine biases and to build that trust and mutual respect. And we would suggest thinking about doing systems mapping and building local community commitment to identifying both small p and capital P policy issues so that we can make things easier for families to accomplish all that they're trying to achieve within those early months. So the thing about reproduction is that more than anything else, it tells you how a society values people. And we're feeling inspired that we're seeing a growing investment in maternal health and these kind of conversations, and we just want to lift that up and appreciate that.
Thank you so much, Sarah and Nkechi. And I know, Chloe, you're going to come in and do the Q&A section. But before you do that, I just wanted to say that from our perspective, we were so thrilled to have Dr. Verbiest to come in and talk about fourth trimester and her work, and just really wanted to gauge your interest, because we think that this is a topic that, as she mentioned, is going to help us to achieve our goal of assisting every child to be ready to learn. And so if you have an interest or would like more information or more support in this area, please do let us know. We are very interested in hearing that. And so with that, I'll turn it over to Chloe.
Hi, everyone. Good afternoon. So we have a few questions, and amazing questions at that. First question from Devin. Do you have the study on rapid brain development for new parents?
Yes, we can find that citation for you. I don't have it right. I did not put that on my slide, so I'll need to go back and get that, but I can get that to you.
Leslie has a question as well. How have you connected with home visiting programs?
So we've done that in a number of ways. Here in North Carolina, several of my colleagues that are part of the Jordan Institute for Families, we've worked closely with our McV program here. We actually did a mapping of all home visiting programs in North Carolina and understand what they offered, where they offered it, and we are doing our McV needs assessment currently for the state. At a larger level, I've had an opportunity to do webinars for McV, and McV now has a COIN project, or a collaborative project, that's looking at postpartum care, and the fourth trimester team is participating with them on that project. We also support national legislation that's looking to double the amount of resources available to McV so that we can really continue to extend that home visiting and support services to a lot more moms.
Thank you. Natalie asked, how can one become a specialist in this field? Infant mental health in particular. Any incentives for professionals to join this field?
So there is an infant mental health association group that I can get you more information about. It's definitely a growing field of interest. And something that I think is important when we think about infant mental health, that in many cases it's really maternal health that is so inextricably linked to infant health. So sometimes I do a tiny, even though I understand that infant mental health is about the dyadic support, I think language matters. And so I think that there is a lot of room for thinking about how we can help babies and support babies, but then also in the context of moms. I know that there's always a need for more well-trained mental health providers that really understand this important period of time. And I can also find the contact information for that association and get that to you, because I do believe that they have a national training program. So I'm sorry, that was a very messy answer to a short question.
Next question is from Caitlin. Can you please repeat the time frame you gave for when the information on the website will be translated to Spanish?
Absolutely. As soon as we get our contracts in place, which we hope will be by mid-March, we will start the process of having that translated. So our goal is that that is completed and launched by September of this year.
Awesome. Celine asked, some Head Start programs offer a pregnant mother program. Once the child is 6 weeks old, they are automatically enrolled into the early Head Start classrooms, free childcare. In your experience, do you know if moms look into their local Head Start?
I don't know. I think that that is, again, where when we think about that suggestion for a postpartum planning and really having clinics engage with communities, I think there's a real opportunity to make sure that women know what resources are available and know how to access them. So I think that's an example of some of the systems gaps, that it would be really nice if we made it a lot easier so they didn't have to search that out. And then I would also say that with those child care providers and with that service, having them be really sensitive to the experience, that postpartum experience, so that when moms come in and they might be late or frazzled or something, that they can be, again, compassionate and kind and lifting up what she's doing well, I think are some two thoughts that I have around that. And I think it's also a wonderful program, because a lot of moms, if you think how early many are going back to work, how expensive it is for childcare, knowing that your child is someplace safe is, I think, an important way to help relieve maternal anxiety and depression.
Awesome. Christina asked, some of these knowledge gaps are due to the fact that they are taboo topics: mental health, breastfeeding in public, hemorrhoids. She is wondering how you, the 4-trimester program, have worked to change mindsets and make these things more common to talk about.
Sure. So any chance that we get to talk to a reporter or get interviewed, we always take that opportunity and talk. We have an opportunity like we have today to talk with all of you. We have this new project that we're starting is going to allow us to build out ACOG's Postpartum bundle, which I think will help us put prompts for providers to ask these difficult questions. So one place that we're starting is to really talk to providers and say, you need to ask her about incontinence. You need to ask her about pain. You need to ask her how she feels about having sex. You know, there's so many assumptions, and so women are going to think that they're not quote unquote normal, and so they're too afraid to raise that question. And so part of what we have to do is ask the questions, and we have to, all of us, try to normalize some of those conversations. We are really trying to do that with newmomhealth.com. If you look at the site, you'll see that we are not shying away from talking about those things, and there's a lot of that that's starting to happen more in that social media space. And so I think it's a culture shift, but it's all of us acknowledging that these are very common recovery challenges that in some ways are kind of like your badge of motherhood. And I think we just kind of honoring them and talking about them is really important. And we are doing that every chance we get.
In your materials, do you include information for adoptive parents who may also be new to this world? While some of the challenges won't exist, namely physical challenges, a lot of the information is relevant.
Yes, absolutely. So when we were putting New Mom Health together, we also were working with some moms that had adopted babies and designed it so tried to design that to be as inclusive as possible, because fatigue is going to affect everybody. Backaches, neck aches are going to affect everybody. Trying to read cues, trying to understand their new role, their self-identity, all of this is still part of this complicated mix. They may not just have that physical recovery from birth. And so we tried to have that information in a way that that people could get what they needed from it. But we definitely were thinking about that group of moms. We also have been thinking a lot about, for example, people that give birth that may not identify as moms. So we are about to add some new content in there for people who are transgender or non-binary. And so as we go, and we're trying to do our best to also normalize the experience of lots, and I just said the word normal, but I just said it, but to identify the common issues across lots of different groups, but then provide some of the unique information for unique groups, such as moms who have babies in a NICU.
Awesome. Are you all aware of any grants that you all are, that may be available to assist with things such as infant care packages for new mothers that may not be able to afford supplies?
We are not, but we think that would be awesome. It would, and we do talk about this when we think about this idea of the baby shower, and there's been some really kind of neat work about how we have a mom shower. And so thinking about kind of in advance of a birth, are there products and lists, and we do have lists on the website about things that would be really great for a mom to have or for people to gift to her. So we have recommendations of what those kind of gift packets would look like. It seems like that could be a really nice local initiative that maybe a local foundation would be interested in. I think it's such a wonderful way of expressing care, and especially if she has it in advance, I think it can really make a difference. So I totally love that idea. We were working with a company, I can't say their name. They are coming out with a lot of products, which we think are great. We also find their products to be expensive and have been trying to work with them about potentially making their products available to low-income moms. We're still working on it. But like I said, yeah, we're working on it. I don't know if we'll have any luck. But they do have a line of products that I think is along your lines of what new moms would need. Sorry, rambling answer.
I am a part of Early Head Start in Alaska. Welcome. We are a home-based program right now, as well as being only a year old. Do you have any other tips for us who are just now taking on pregnant moms and moms with newborns without much to go on as info for our families?
Can you say that last part of the question one more time?
Rephrase it a little bit. Do you have any other tips for us who are just now taking on pregnant moms and families with newborns?
Yes, yes. I would say that really thinking about and being mindful of all of the different tasks that these families are undertaking. When you think about the visual that we presented, where you're thinking about its identity, its self-care, its baby care, family care, relationship care, dealing with in-laws, grandparents, it can be we haven't even talked about mothers-in-laws, right? It can be a very complicated space for families. And so I think, first of all, thinking about that, understanding that, taking time to really listen to the people that you're serving, getting their input as you're designing programs, getting their input on the services that you provide is really important. We have loved doing that work. It's fun work to do. You get to hold babies while you talk to moms. It just doesn't get much better than that when it comes to research. And I just think really listening to what they have to say and what they need would be something that I would definitely encourage you. And I think not being afraid to talk about what to expect postpartum and to really help lean in when it gets uncomfortable as they're trying to make plans and they identify a real sadness, for example, that someone they love isn't going to be able to be with them, or real concern that they have to go to work 10 days after they have their baby and they don't know who's going to take care of that baby. I think really walk with them and help be a connector for them across those systems. And I think also locally there's a lot that we can do around paid family leave policies. Sometimes we can't get it at a state or national level, but sometimes you can make some headway with large employers and with local government.
Charlene Nunez asks, can you share more on centering programs? We are a community-based mental health clinic in New York City, and we are not as familiar with those programs and or how to connect to them to provide wraparound support at this time.
Sure. There, I can send the link, or maybe Andrea has the link to Centering Pregnancy. So I think it's the Centering Institute, which has a lot of great information and resources. And so these are two new models of providing well baby care and prenatal care that focus really on people owning, how to take their own blood pressure and kind of owning their own health, but then having an hour and a half to be in community with others that are in kind of the same stage of life and development, and learning together and asking questions together and becoming friends and creating community. And I think that, we're relational beings, and being able to be together, it cuts through the isolation, and people may have questions that we had that we didn't think to ask. So I think whenever we can look at how we can bring groups of people together, it's very powerful. So the Centering Pregnancy and Centering infant care work in clinical settings because you can actually be billing for those visits, because there are a lot of prenatal visits and a lot of infant visits. I think in a community setting you might need to get a little bit more creative about how you would fund that. But likewise, if you have a facilitator and a space for people to come together, and you hold these meetings at different times when moms can actually get together, I think it would be something that would be worth trying.
Sass from Arizona asks, is there an initiative to reach pediatricians or OB doctors' offices?
We're the initiative. Yes, there is. It's just a matter of identifying, the resources that's needed to actually, tell people about this work. But we work closely with ACOG and lots of really amazing partners, and are, as I mentioned, hoping to design some new materials around the postpartum visit. So I think we've got some work and energy that's going. And always it's great to have partners to help us amplify that work. And I do love your idea of really connecting with pediatricians, because for them to be able to share this information, like newmomhealth.com or other information, seems like that would be an easy win for them. So I think that's a great suggestion. And if any of you have ideas for us about how we can continue to do that, we would welcome them.
I also wanted to mention to Charlene that we actually recently had in January a Centering Pregnancy, we had a webinar in which our Centering Pregnancy executive director and program manager had shared more information related to that topic on prenatal group care, and so we'll be sure to send that information to you. Next question. This webinar is very informative and eye-opening. Thank you, Celine, again. Do you offer any trainings to pregnant mother home visitors?
So do we offer training for home visitors? We don't. I think we could design one, and we could work with McVie and others to design one. We can also be great to reach out to some of the home visiting models and really connect with them a little bit more and see what they're doing. We did look at many of their materials when we were designing New Mom Health, and found that a lot of their materials were still pretty infant-centric. And that's important because moms desperately want their babies to be healthy and well. So I think moms definitely want and need that information about infant care and development, so it's so important. But I think there is room to be really layering in some more training and information around that postpartum space. So that sounds like something that we could consider also developing. It's a goal that we had to kind of partner and pair training resources with the newmomhealth.com website. So
Marie,
you're inspiring me to do more.
Wonderful. Marie asks, I work in a teen parenting program and was wondering if you have addressed any concerns/issues for this age group.
Yes. We haven't, well, we were thinking about that when we were designing the site in terms of trying to have different, reflecting lots of different ages, and we did put information on the site about going back to school, because that can be really challenging to navigate, going back to school and making decisions around that. We know that a lot of the postpartum feelings and recovery is very similar, and that there are definitely some unique relational challenges. So yes, we definitely have been thinking about that group of new moms, tried to keep them in the website. I think there's more that could be done to really support them, because when it comes to their identity formation, it's particularly complicated, right? They're still trying to figure out who they are, and now figuring out who they are as mothers is complicated. So it's very important, and I know that there are definitely some excellent home visiting programs like North Family Partnership that I think cater uniquely to adolescents, and I think that having home visiting services and supports that are unique to adolescent parents is so important for that good two-generational impact. And if you know of any, please let us know. And if you have any good resources, please let us know, because we are always eager to kind of build that repository of good programs and good resources.
Next question from Charlene. Are you able to email the webinar on centering pregnancy, or would I have to register for it? Actually, we can definitely email that to you. That has already passed. It took place in January, but we definitely have the materials, and I'll be more than happy to help you and assist you. Do you work with any specific groups for mothers in substance abuse treatment? There are groups who really need this level of support so badly.
Yes, they need so much support, and unfortunately, with just the way that there's legislation and the incredible bias that's out there against these moms, it's I think can be really disheartening for moms that are really trying to do everything the best that they can. So we have a program at UNC called the Horizons program, which is very unique in the country, and the Horizons program has kind of a sister program out kind of in our mountain area and our coast area, and they provide really unique care for both mom and baby and mom and children in a therapeutic setting, which is really fantastic, so that mom is getting the support that she needs, that there's child care, so that the child is well attended to, and that there's also an opportunity for that kind of relationship with other new moms. So that's a really excellent program that I could definitely share more information with you about. I really think we all need to be champions for moms that are using substances. It's such this inclination for mom and baby to be separated, and I know there's new legislation being proposed in North Carolina that would actually move like that to permanency very quickly. And when we think about that interconnectedness and interrelational nature of new moms and babies, we really should be identifying and supporting programs that are serving both of them and not trying to serve them separately. But yeah, the UNC Horizons program would be a program to consider looking at.
Perfect. And last question from Amy. Do you plan on translating your website altogether into other languages? The website looks amazing and very informative. I feel like many immigrant families can benefit from these materials.
We would love to do that. I think once we practice doing this into Spanish, and as a note, we are designing that with Latinx moms. So it's not just a matter of pushing a button. It's really thinking about the images and how we're saying things that's really important. And so we'll have that experience this year. And so I think that we would, of course, be eager and happy to do that in other languages. And if people can identify people that we could work with to help us do that, we would certainly be happy to talk to you about it. And like I said, especially because we'll have experience having done that this year.
Great. Thank you, everyone, for your questions.
Chloe, are we ready to close out the webinar and say thank you to everyone for joining, and thank you, Sarah and Nkechi, for your wonderful presentation. It's been amazing. Just thank you all.